Wikidontist.com. Truth about tooth.
Lower jaw is one of the most strong bone on the face itself, but the growth of it can be restricted, can become large, so it is also an aesthetic problem. So today we are going to look at what are the different treatments that can increase the growth of the lower jaw or redirect the lower jaw to get a better look for the face. So if there is a lower jaw which is actually very small, what happens is you will look as though your maxilla is very big and you will not be having a great smile. You have a convex face and you will not look very good. So if you have a very small jaw, we can actually use the simplest method. If you are finding it at a very young age, then we can use a functional appliance like a twin block and make it much more longer when you are actually growing up. When the child is growing up, actually when he is becoming tall, all the long bones become longer. So at that time, if you can use a growth modulation device like a twin block or a functional appliance, we can actually move the jaw forward and then make it into the maxillary size so that it will match the upper jaw. If the child is actually coming at a later stage, what can we do? In most of the cases, we will have to go for, see, if it is a very small jaw, we will have to go for something called as a distraction osteogenesis, which is partly surgical part and there is an orthodontic part to it, wherein we use screws which can be adjusted after it moves a lot. It can move a lot of bone and it can make a lot of, it's just like if you have a problem with the with your leg which is shorter, we can actually make it into longer leg using the newer techniques. So it's something which is much more elaborate, but if it is a moderate case, we can actually use the orthodontic techniques to correct it using some of the functional appliances that can be incorporated into the orthodontics itself and then still correct the position of the jaw and have a great look. Now if it is even if it is reduced to a very small this thing, then we will have to use a surgical method by using graft bones from other parts of the body and we can actually make it larger. If it is very large, then that's another issue. If the jaw is becoming large and then we have some of the restrictive this thing, but it's not found to be very good. But if it is a mild or a moderate case, we can actually correct the dentoalveolar, where the bone which is having the tooth can be moved along with the tooth using orthodontic treatments and things like that, or surgical corrections can be done. But if it is a mild to moderate cases, we can actually do it with a implant assisted orthodontics. Implant assisted orthodontics, what it does is actually takes if we can remove one or two teeth and then if we can give the pressure from the implant, the back teeth will not move forward and then we can actually move the mandibular teeth along with the alveolar bone backwards and then we can correct the most of the cases. If it is a very large disparity, then mostly it is, if it is due to a vertical correction, we can still correct it with orthodontics. But if there is no vertical this thing, it's only a horizontal issue, then, or if it is very long, then we have only option of surgery. So the surgical option is also not that very bad, but it is very good in cases wherein there is a lot of length for the bone. We can correct it but that also requires extraction of the teeth and then we'll have to do a surgery and then we need to take the jaw back. So at whatever age you are finding it or whatever level of this thing, still we can correct it. You don't have to worry about it. It is a simple, even the surgery is so simple, it doesn't require much of a admission to this thing. Maximum it requires 5 days of treatment in the hospital, and then maybe now with the new fixation systems, in 1 month you will be just fine and you will be able to go to your normal routine and things like that. So but if you are worried about surgery, we still have options in the orthodontic wherein we can go non-surgically and correct all these what you call issues with the jaw and issues with the bite especially. the jaw may not move accordingly, but when the vertical correction is done, most of the jaw issues will be camouflaged, or even the bite is corrected. Most of the time you will be happy with your smile and things like that. So if you are worried about one or the other, or if you have a specific question, please put it as a comment on this video. I will be happy to assist you with my suggestions on what has to be done for your specific case, or whether it is required to go for surgery only, or things like that can be discussed on the comment part of this thing. Please subscribe me. If you like the video, please press the like button, and also put the bell button on the subscribe this thing. Please make sure that you send it to all the people whom you know who has this problem, so that they will also be benefited from this. Thank you very much. Have a great day. Have a great smile. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi.
Wikidonist.com